Good afternoon, Capital City. It's time for our health spotlight. As you know, there's been much going on currently that deals with our health, and all of us have been seeing and hearing much on the news, much from our friends and family about the latest happenings with this COVID virus. And so we have the privilege of having Dr. Avonelle Dorant on with us this afternoon to help give us an update about some of the changes that are going on, some with the symptoms and so forth. So, Dr. Avonelle Dorant, welcome.
Thank you so much. Thank you so much, Sister Manitha. Good to see you.
It's good
Looking
to have
lovely.
you. I know that you have probably been swamped with all of what's happening now, and if you care to share with what's happening in the hospitals and so forth, we would love to hear some updated, up close personal information. If you care to share, we'd appreciate it. Thank you so much for being with us.
Thank you. I appreciate it. Thank you for the lovely introduction. Good afternoon, Capital City family and friends. We are so glad that you've tuned in to be with us today. Happy Sabbath to you, and I hope you're having a lovely Sabbath. Like our First Lady said, my name is Dr. Avonelle Dorant, and I am a physician. I am actually an anesthesiologist, so disclaimer, I am not an infectious disease specialist. However, I just wanted to share with you some reminders and things that you can do to try and keep yourself healthy during this time. These are unprecedented times. We are now 2 years into this COVID-19 pandemic, and whoever thought that we would be actually living through a pandemic? Everyone is experiencing COVID fatigue. We want to have breakfast with our girlfriends. We want to go back to the gym. We want to travel without having to think about COVID and having to think about getting sick. We miss our church family. People have not come to church because they're afraid of exposure, stuff like that. The introverts are like, nah, I'm good. But if you're an extrovert, if you're a people person, then you like to get out there and, you miss being around people. So instead of us coming to the end of the pandemic, what's happening is like, if you're at work, everybody is coughing around you, everybody is sniffling. And so many of our staff members, so many of your work members, I know where I work, I'm in the hospital every day. And up to Monday, one of my colleagues, Dr. Murray, who you guys probably know, we work in the same facility. So we work for IU. And I remember he texted me and he said, everybody is coughing. This is really scary. And at that time, nobody was coughing in my room. But then I changed surgeons like an hour later, and sure enough, my surgeon was coughing, and I was like, he probably has it. So there's no end in sight, and we all have to do whatever we can to stay healthy and to survive this pandemic. Right now, the virus is running pretty rampant, which means it's running unchecked. Indiana yesterday, actually, we had the all-time high for COVID-19 cases just yesterday in terms of the count, people that became positive. There were a total of 15,277 new positive cases yesterday. And this was actually the highest single day count since the pandemic began. So instead of things getting better, it seems like they're getting worse. It's impacting your job. It's impacting my job. There's several people, many of our colleagues are sick. Many of our workmates are testing positive. Some of us have family members that have also tested positive, and either in our homes or across the country, we're dealing with this very, very close to home. So I just wanted to share with you some reminders to try and help us all to stay healthy, help us all to stay negative. But if you would happen to get it, because it's going to probably become endemic, then what can you do to try and mitigate it, lower your viral load, and try to make sure that you juice up your immunity system, but still tamping down your inflammatory response. Okay, those are the things that are important. So this latest variant, of course, is called the Omicron, and the symptoms are a lot milder than Delta. And that's a good thing. It's actually a blessing because it's it's easily spread because it lives more in the nasal pharynx and the sinuses, and it has an affinity more for this area than for the lungs. So what that means is that it's more frontal and it's going to spread more easily. The symptoms, thank goodness, are milder than Delta. So with the Delta variant, what people told me, what my colleagues told me, some of them told me that they felt like they were going to die, like they couldn't breathe, they were so short of breath. Some of them, the stats never fell, like the O2 saturation never really came down, but they were feeling very sick and just not well at all. And it lasted like 2 to 3 weeks in a lot of cases where people were very winded, and then they continued to have symptoms for sometimes for weeks and sometimes for months. By that time, it's called long COVID. Now, with the Omicron variant, the symptoms are a lot milder. So what we're seeing is that if you're coming down with congestion, if you have fever, if you have a cough, if you have any muscle aches, if you have headaches, then those are all symptoms of COVID. And I'm gonna just bring up my, like, so I said runny nose, cough, fever, chills, muscle aches, or myalgias is the other word. Loss of taste or smell, you can still get that, but most people are not complaining about that with the Omicron variant. Sore throat, any kind of GI symptoms. So the Omicron is also causing a lot of gastrointestinal symptoms. Some people are getting nauseated. Some people are having diarrhea. And those are also symptoms of this particular variant. Dizziness, headache, and shortness of breath, or breathlessness, and also fatigue. If you're experiencing any of these symptoms, very possible that you have COVID and you need to be tested. You don't want to assume that this is just sinus congestion. You don't want to assume that this is just a cold. You don't want to assume that it's the regular flu. It could be those things, because actually the flu is also coming back to us. And many people are also suffering with the flu. But you definitely, if you've had an exposure, even if you don't think that you have it, my suggestion, my advice is that if you're having any of those symptoms, that you need to get tested for COVID, because you can very well be positive. And you want to know, this is not the type of thing where ignorance is bliss. You definitely want to know if you have COVID. Because the thing about COVID is you need to kind of pay attention to the timeline. And I can't get into this right now, but just to let you know that the time that the first week is a regular viral illness, and most people recover. You may have a fever for a day or two. You have a lot of runny nose, stuffy nose, and coughing. But after that, people recover. But then there's a second phase to this illness where you have a increased inflammatory response. And that's when people tend to kind of go downhill. That happens usually at between days 7 and 9. So it's very important to be aware that even if you've gotten through the first week, you may not be completely done with the illness. Omicron, however, seems to be a lot milder in terms of what it's causing than the Delta variant. So if you have those symptoms, make sure you're getting tested. If you don't go anywhere and you live by yourself, the virus is not going to come and look for you. But if you have to go out, if you have to go out to a job, if you have to go out to school, if you have to go anywhere, then you're going to probably encounter the virus, possibly. And so some of the things that are very helpful are some of the things you already know, but I'm going to just go over it. One of the most important things that you can do to protect yourself and your family members can do is you have to wear a mask. This is not political. This should not be Democrat versus Republican versus independent. Everybody needs to wear a mask if you have to be out. It is proven that it's a very effective way to shield yourself from the virus coming towards you. And in terms of a mask, many of you, at first we were told, wear anything over your mouth and nose, whatever you have. And so a lot of us got very pretty decorative cloth masks like this one. And whereas these are better than nothing, it's time to upgrade your mask. So what I would suggest, and what is being suggested by the CDC as well, is that you upgrade to a surgical mask. And with the surgical mask, it actually does a better job of containing, like if you were to sneeze or cough, it contains those particles a little bit better. So make sure that you have a surgical mask on. If you want to then cover it or wear a pretty decorative cloth mask over it, then that's fine. And then there are the KN95 masks, which are made in China, and they are, I don't know if you can see it, they are very effective as well, but they've not been certified for use in the United States, at least not for healthcare, not in a healthcare setting. But they're good, they're effective, and if you have it, then you should definitely wear a K95. Now, if you're in the hospital setting in the U.S., the mask that we are wearing, especially when we encounter COVID patients, or if you're in a room where people are coughing, or if you're just in the room, period, I'm now wearing an N95 every day. So we're wearing the N95 made by 3M. And there are two types of N95s that are very effective. There's this one, we call it like the fish mouth N95, because it has a very broad front and it's very comfortable to wear. It opens up, there's a pretty big opening in the back here. It's very comfortable. You can breathe a lot better. And then of course there's the green N95 as well that you may be familiar with. It's a very small opening in the back that fits you. It fits very, very snugly, so you really can't smell very much coming towards you, which means it's stopping the particles, but it's also kind of hard to breathe. So this is the one, if you can get a hold of the 3M mask that has a fish mouth opening, then you can, put it on, and you want to make sure that you have your mouth and your nose covered. It is not adequate to cover only your mouth. It needs to fit firmly over your nose, all the way down to your chin on both sides. And then if you want to have a fashion statement, then you can go ahead and put the cloth mask over it, and then you're good to go. But you should not be going out anywhere where you're going to be encountering people. That is, if you want to go to the park, that's fine. But anywhere where there are going to be people, you should definitely have a mask on. And this is a very safe and effective way of protecting yourself. The other thing to note is that it's very important to continue to keep an eye on your diet. Very important that you're eating right, you're drinking a lot of fluids. You need to be consuming a lot of water specifically in order to keep your immune system in tip-top shape. You want to be reducing juices, because of course juices have a lot of sugar, and that's exactly what you don't need right now, because it literally pulls your immune system down from the time the sugar hits your system, at least for 2 to 3 hours. You're compromised during that time. So water, green leafy vegetables, kale and other salads every single day. And then there's a superflu bomb recipe that Debbie Jones, Sister Jones, was nice enough to share with me. And I made it for myself and my family, and we were able to use it all week. And I think it was very helpful as well. And it has garlic, onions, turmeric, fresh ginger, cayenne pepper, honey, and water. And the reason why this is an effective natural antibiotic, antiviral, is because garlic and onions and turmeric and ginger are all anti-inflammatory, and they all boost your immune system. So that's something that we used this week, and we were sipping on it for the entire week. And I think it really helped everybody to try and stay healthy. And those that have had COVID, it just helped to keep keep them feeling better and bring them back to health quicker. In addition, there are certain supplements that you should not be without, your home should not be without right now. And you need to be encouraging everybody in your home to use this. And those are vitamin D. So I'm actually using vitamin D, and I use 5,000 units per day. So pretty high strength. We know that in the winter, the vitamin D levels, those of us who have a little bit of pigment, the melanin in our skin actually hinders or inhibits the absorption of vitamin D from the sun. So it is imperative that you are supplementing with vitamin D. If you have if you have not had your vitamin D level checked, I encourage you to have your doctor draw your blood and have your vitamin D level actually checked. I had mine checked in October and it was actually low. It was on the low side. It was lower than the normal range. So I knew that I had to kind of make sure that I'm taking vitamin D every day and not just 1,000 or 2,000. You want to be taking like 10,000 units a day in order to get your level up and keep it on the high side, because the normal range is from 30 to 99. And in order to fight an infection, you want to make sure you're towards the high range. So it's not a vitamin that you can very easily overdose on. So definitely you want to be getting on vitamin D. The other dietary supplement that's very, very important is zinc. So zinc, I try to take 50 milligrams a day. 40 or 50 is usually adequate per day. It's very good for immune health. It helps to inhibit the virus from actually binding to the cells in your nasopharynx and oropharynx. And well, it has to bind in order to get into those cells. So for those who have a bad reaction to zinc, there's some people who seem to be allergic to zinc, or it causes an abnormal amount of nausea. You want to take maybe a zinc lozenge instead of the zinc pill, but you got to get some zinc in your system one way or the other. And of course, trusty old vitamin C. Continue to take the vitamin C. I would say 1,000 milligrams a day, 2,000 milligrams if you have COVID, or if you think you've been exposed, you definitely need to up it. This is a water-soluble vitamin, so this is not something you can overdose on. You will urinate it out, the excess. Another supplement that I have been taking throughout the pandemic is garlic. And so in addition to taking garlic, fresh garlic, like in the super bomb flu, I have been using something called high allicin garlic, and it comes in like 600 or 500 milligrams. This one is 1,000 milligrams. It's 1,000 milligrams per pill. And actually it doesn't say, okay, it's a certain amount, but it's supposed to be very good. This is 500, sorry, not 1,000, but it's supposed to be really good. It's a vegan supplement, and I got it at Fresh Time. And high allicin garlic, because garlic supports the immune system, but as well as tamping down the inflammatory response, is something that you definitely need to want to be taking. Sleep is essential to keeping your immune system in shape. If you're not getting sufficient sleep per night, you're definitely at high risk for picking up viruses and bacteria. And if you have two people that are exposed to the virus, one doesn't get sleep and the other one does, very likely the one that gets sufficient sleep is less likely to convert to positive. Whereas if you are sleep deprived, then you are compromising your immune system. So you're going to be more likely to test positive. So you can take melatonin if you have trouble sleeping, and it's worth it to get a good night's sleep. So adequate rest is essential in order to keep our immune system in top shape. And then if you have an exposure to COVID, like if you have a close contact, then at that point in time that you had a close contact, you need to be doubling down on these vitamins, and you need to be starting to grate that garlic and cutting up you can cut up the garlic very small and grate the ginger and put onions and then blend that. And it's not the best tasting concoction, but it will help you. And just be taking spoonfuls or mouthfuls, like a teaspoonful every few hours, because that's going to really help. Now, if you've been in a close in an enclosed space with someone who um, later may test positive for, if you've been in that space for over 15 minutes, then you have an exposure and you're at high risk for also converting to positive. One of the things that I think can help you and decrease your viral load, and this is something that I've been doing for a couple of months, and it's been actually proven to help reduce viral load. I've been gargling, so I I use the Crest alcohol-free mouthwash, but instead of just using the Crest straight from the store, I actually add hydrogen peroxide. So I'm adding like 50%, like almost like half and half hydrogen peroxide to my mouthwash. And in addition to that, I add a couple of drops of providone iodine. And this providone iodine actually, let me see if I can find, okay. CVS covers this. CVS carries this 10%. So this is what we use in the hospitals to prep surgical wounds before we do the incision. So in order to get rid of all the bacteria that would be on the skin, we scrub the skin. Those of you who have come to surgery, this is what we do with providone, iodine, and alcohol. So there have been studies that have shown that if you gargle with providone iodine, it needs to be diluted. It's way too strong. You can dilute it half and half with tap water, or even just to put a few drops in your mouthwash every day, morning and evening, and you gargle with it, it does decrease the viral load. My dentist, he has this gargle for like a minute, which is really hard to do because you tend to gag. But they use a hydrogen peroxide mouthwash, and he has a gargle, and it has been proven to decrease the viral load, so that patients who might come in, because they don't have patients test before they do dental work, so they might be encountering some COVID positive patients, and this has helped to keep them healthy as well. So these two things added to your mouthwash, if you haven't been doing it, I would very strongly advise that you start to do it. It's inexpensive, very effective. Hydrogen peroxide and providone iodine. Some people also use, like they would put some providone iodine on a Q-tip and clean the nostrils, because that's where we know the Omicron variant is living and multiplying. So they may kind of use a Q-tip and wipe the nostrils out pretty frequently. I don't really like to put stuff up my nose, so I do something which I can tolerate, but other people can't tolerate. I actually do sinus rinses. So I've been using my neti pot pretty frequently within the last 2 weeks, especially, and there's a saline, there's a sinus rinse that you can use. This is by Neil Med, and you add. I use distilled water or boil your water. I would not put tap water, and I don't advocate to put tap water up your sinuses. But if you want to do a sinus rinse, use distilled water, and actually like Walmart or CVS or any pharmacy sells big gallon jugs of distilled water. Use that, or boil your water, let it cool down, of course, and fill it up. Put in this is the saline mix for the sinuses, for the sinus rinse. And then I've been adding a couple of drops of providone iodine to my water. This is very effective in killing viruses and killing bacteria. So those are some of the things that I've been doing to help me keep healthy. I really think that it has been very effective, because I know I was exposed to COVID, unfortunately, over the Christmas weekend, and I was, thank God, for His grace and mercy, I did not test positive. I continue to do it because I also encountered the virus at work. I know I do, because people are coughing and hacking, And as you know, the CDC recently changed its guidelines for quarantine for those that are testing positive from 10 days to 5 days. Well, what that means is you're having people coming back to work in your space and they're still positive. And even though we know that the virus, you can start to be contagious 2 to 3 days, maybe about 1 to 2 days before you start to have symptoms. So you may be exposed to somebody and they didn't even know they had it. So one, they're coming to work and they probably haven't tested positive. Two, they're coming back to work before they have converted back to negative. So definitely in the healthcare setting, I know we're working with people who are COVID positive. And because of that, these things that I just talked about, especially the rinses, especially the iodine to gargle with, it's not something that's hard to find. CVS carries it. It's not expensive. These are very inexpensive ways that you can keep yourself safe. So at some other time, I'll have to talk a little bit more about the pathophysiology and what's going on in your body that makes some people so sick and others don't get sick. But we're just grateful that the virus has mutated into a variant that's actually less harsh than the Delta variant. Now, as far as vaccinations versus not being vaccinated, I am not here to push one versus the other. That is your decision. What I can tell you is that we really are seeing in the hospital that a lot of people that are getting very sick are those that have not been vaccinated. Of course, there have been concerns about these vaccines. There are newer vaccines. Yes, we cannot tell you what's going to happen in 10 years. That is true. And there have been some people that have had bad reactions to the vaccines. I think that to deny that is just being very dishonest. Most people have done quite well, or they have only had a day or two of symptoms. And honestly, if you have been vaccinated, there is a big difference in how your body is handling the virus versus those who are not vaccinated. You need to be aware of that. Indiana recently came in dead last, 51st in terms of its safety for safety measures for COVID-19. They took into consideration transmission, hospitalization, death, positivity. In other words, how many people that test are actually converting to positive, and vaccination rates. And we were dead last. So what I'm saying that to say that COVID is out there and it's spreading like wildfire, and we have to be mindful of this. We have to protect ourselves. If you can get vaccinated, then I think that you should. And it will help to protect you. But these are things that you can do regardless of if you're vaccinated to help protect yourself and your family. Thank you so much. I will turn it back over to our hostess.
Well, I got my water. Now, as far as that garlic and onion, I might need a little tomato sauce and some pasta to go with that. So
add some honey, do whatever you need to, even if you have to put it in some orange juice. I'm not a big orange juice fan because orange juice and juices have sugar, but it's better than not taking it at all. Those things are very helpful. I have my coconut water. Yeah. I don't like water, by the way. So I have to push myself to drink water. And what I've been doing is adding some lemon or lime to my water. And I find it so much easier to go down if I just add something to it.
Yeah, we have to find easy ways to try to be healthy, but we still need to make those changes, right?
Absolutely. Absolutely.
Yeah. So thank you so much, Dr. Dorant, for joining us and enlightening us with all the information that will help better serve us to be protected as we deal with this virus.
You're very welcome.